Hello and welcome to today's open event titled Discover Our Advanced Minimally Invasive Surgery and Aesthetics MSc Programs. Thanks so much for joining us today. My name is Kate Thomas. I'm the Events Officer for the Faculty of Medical Sciences here at UCL and your chair this afternoon. We are hoping this session will address those course-specific questions you may have and will help you to gain an insight into what it is really like to study advanced minimally invasive surgery and aesthetics here at UCL. So this afternoon, our speakers, Ash and Zara, will kickstart the event by providing you with a summary of our exciting postgraduate programs. This will then be followed by a student experience presentation from two of our current postgraduate students, Antonia and Kishan. We're also so delighted to have Lauren from admissions here today to talk us through the application process. There'll be plenty of opportunities for you to interact with us throughout, and we have a Q&A session following the presentations today. This session is being recorded and will be made available on our website following today's events. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. Now to introduce our speakers, we have Ash Musahibi. Ash is Honorary Professor at the Department of Surgical Biotechnology in the Division of Surgery and Interventional Sciences here at UCL. Ash is involved in pioneering research work on regenerating new tissues through new biomaterials and tissue engineering, as well as clinical trials in innovative techniques in wound healing. Professor Musahibi and his team of experts lead a comprehensive Masters of Surgery and Aesthetics and Minimally Invasive Aesthetics at UCL. And Zara Mori. Dr. Mori obtained her PhD from Royal Free Hospital at UCL and has many years of experience in research and education at academic institutions in the UK, such as Imperial College London and the Institute of Cancer Research. Currently, Zara is leading the MS Aesthetics program and is passionate towards improving the students' experience throughout their journey at UCL. And Kishan Chef. Kishan is a current postgraduate student. Dr. Chef is a cosmetic and restorative dentist. His special interests are in facial aesthetics and dental implantology. And Antonia Fuchu. Antonia is a current postgraduate student here at UCL. Antonia's degree is in medicine and she continued her training in general surgery. She is now in her final year of plastic surgery training in Nicosia General Hospital. And Lauren Moon. Lauren is currently working as an admissions officer in the graduate admissions team within student and registry services. She specifically works in the team that handles applications for graduate programs in the School of Life and Medical Sciences. This includes Division of Surgery and Interventional Science, which houses the MS Aesthetics programs. Thank you so much all, but before I hand over to our speakers, we would like to run a few polls for you to answer. So hopefully you should now see that we have a few poll questions up on the screen. So we're really interested in finding out where you are currently based. So are you in the UK? Are you overseas? And which pathway are you interested in studying if you join our program? So are you interested in the minimally invasive aesthetics or the aesthetic surgery? And what is your current profession? We have a selection of options available in the drop down, but equally if your profession is not listed, please do drop it in the chat and that would be really helpful for us to know for the Q&A part of the event. I think we're just waiting for a couple more answers and then I'll share the results. Okay. Launch the results now. So hopefully you should see the results in front of us. So I can see that we actually have an equal split for where you are currently based. So 50% in the UK, 50% overseas. And again, we have a split for the course that the pathway that you're interested in studying. So 67% minimally invasive aesthetic and 33% aesthetic surgery. Fantastic. And again, a mixture of current professions. So we have dentists, doctors, surgeons. Fantastic. Well, thank you so much, everyone, for filling out those results. That's actually really helpful for us to know for the rest of the event. So I'll just stop sharing that now. And without further ado, I'll hand over to Ash and Zara. Thank you both.
So Ash, do you want to start then?
Yes, I can see them now. Thank you, Kate and Zara, and thank you all who joined us in this Zoom meeting. And so, as you heard, we've started the program this year, and it's going strong. You hopefully hear also from the students in due course. I'm Ash Musavi, and Zara, you'll hear more about shortly. And we are fortunate also enough to have our course assistant to help us to run it. So you get probably correspondence from her as well as you go along. On to the next slide, please, Zara. So you heard a little about, most of you probably know about UCL. UCL is one of the older universities in London. The building itself is an English heritage building, and is a national gallery and Wilkinson building at UCL. Hopefully, for those of you who haven't seen it or on site will see it, and those of you in London, hopefully will go along and have a look at it at some stage. The current ranking for the university itself is 4th in London and 8th in the world. So I think it's the Shanghai Global Ranking academically from 2021. It's 6th in the world for medical technology. And UCL Medical School alumni are global leaders of medical profession and recent current presidents of Royal College of Physicians and Surgeons. As far as the clinical side is concerned, London major teaching hospitals are connected to it, which includes Royal Free, which my department is based at, and also University College London Hospital, as well as the Royal National Orthopaedic Hospitals. So really, it was back in 1846 that the first operation on the anesthetic was done in Europe, so that's how far the operation, the modern operation, goes back to. So really, just to talk about our vision, you heard a little bit about on the video about it. Really, I think that what's missing in the current aesthetic and cosmetic practice is the standard and accredited training for non-surgical procedures as well as surgical procedures. There are a number of quite good courses, level 7 courses, but none of them are connected to good universities, and particularly to a high-ranking universities like UCL. And this would bridge the gap in aesthetic fields in a partnership with world-class experts and also with British Association of Aesthetic Plastic Surgeons. And the idea is that you guys, the students, continue to be busy healthcare professionals and work in concert with working as a full-time student or even as a part-time student to acquire the necessary knowledge and to improve the outcome that would benefit the patients and, of course, the other colleagues and practitioners. So really, just to go through it, really our goals is to promote and implement inclusive learning and teaching environment This is the postgraduate course, so you're not going to be spoon-fed. We expect you to have some initiative and learn about things, and you heard more about that from our students, hopefully. But it's led by world experts in this, and we have a diverse faculties: consultant dermatologists, cosmetic dermatologists, plastic surgeons, aesthetic surgeons, and clinical teaching fellows.
Great, thank you, Ash. So I'll take over.
Thank you.
If I can change the screen, there we go. So as Ash mentions, our goals and our visions are going to focus on the aims. So we aim to deliver a highly flexible program. So it's, you can play it when you have the time around your lifestyle, around your profession. And it's very much student-based with diverse personal context and background. We aim to kind of develop a critical understanding and ability to evaluate clinical theories, practices, and research-associated elements for both minimally invasive aesthetic and the aesthetic surgery. And we would love to provide our students with an opportunity to apply the clinical theory and the practice and all the associated research elements in the provision of aesthetic surgery and minimally invasive aesthetics. And you will be given a chance to undertake an independent research study in one of these two fields that we offer. In terms of the modules that we provide for our students, there are 4 compulsory core modules for both pathways. And the names are in here. I mean, don't worry so much about the names. So it's about the principles and the fundamentals of aesthetics, and also elements of the skin and regenerative and epigenetics aesthetics. The names might change for the next academic year, so I wouldn't worry so much, but the learning objectives, they remain as they are, and these are taken by all the students that join the program. Then we have pathway-specific modules, so 2 pathway-specific modules for each of our pathways. The minimally invasive pathway will have the minimally invasive aesthetic and the advanced. So these 2 modules are complementary to each other. When you do the first one, you get the basic ideas, and then with the second module, it's built up and gets to the advanced level, built up on that initial ideas. And as Ash mentioned, the colleagues who deliver these sessions are world experts across the globe. For the surgical pathway, so the aesthetic surgery, if that's your interest is in that pathway, also there's 2 pathway-specific modules. That is one to do with the breast and torso, and the other one is with regard to head and neck. So they will break down different aspects of the facial aesthetic surgery and also the body, the torso and the breast, and there are interesting lectures and videos around that as well. So the diet of the program, as was mentioned earlier, is you can join us on a 1-year program full-time if you have the time to fit in your busy schedule. And if you are slightly busier and would like to take a bit longer to finish the program, then you can join us on a 2-year program. So the option is there. Oops. In terms of learning and the educational side of it, so it's kind of advertised as blended learning. And by that, we mean the lectures and the videos and the procedures that we would like to share with you are most often pre-recorded and uploaded on our virtual platform. There is also a few live virtual sessions. So we appreciate that our students come from across the globe, and we're open internationally, and some of them working in their own home countries. So you can just connect online to those live sessions. The rest are pre-recorded, uploaded. You can watch in your own time and manage your time. And then after a number of pre-recorded sessions, we have live sessions with the colleagues who have taught those sessions. If you have questions and queries, areas that you would like further explanations, we'll focus on that as well. And then other than these, we got a number of face-to-face in-campus sessions. The dates for those is usually advertised at the beginning of the term. And we also are very lucky to have access to the Charles Wobson Center, which is kind of the anatomy lab where we do our cadaver-based work practice in there. the teaching or the VLEs, the virtual learning environments that we use at UCL is Moodle. So every module has its own Moodle page and all the relevant information is in there. And once you've registered and got your UCL email address, you get access to those Moodles and to those Moodles for the modules that you are part of. On top of that, due to the pandemic, and also because we are blended learning and sort of virtual sessions, we use Microsoft Teams as a teaching. Microsoft Teams was initially started as a teaching platform anyhow. It's an educational platform. So we have live sessions in there that are recorded. Those who cannot attend the live sessions, they can always watch the recordings afterwards, and the students can upload work in there, etc. The Moodle is just the background of each module, and the assessments and the feedback is through the Moodle. So we use both platforms side by side. Talking about assessment, we have a range of skills that we will sort of test your knowledge in different ways. Reflective case studies, e-posters, whether individually or group presentations. And, you know, we have also the OSCE exams, so the medical school type exams. If you've studied in UK, maybe you're familiar. If not, don't worry, for everything, there's going to be a formative and a summative assessment. So there's formative means there is no credit bearing to the assessment. It's just for students to realize how the assessment is going to take place. So if people are not familiar with some of these terminologies. And the feedback for courseworks and posters and presentations, we aim to make it as constructive as possible. We are always improving in this area. And it's either written for you specifically, or is given as a group feedback to you in the class, in the virtual class. And that feedback could come from your lecturers and your tutors, and equally it can come from your peers. So peer-peer feedback is very important in education. The students who join UCL, whether in our program or all the other programs, have access to a wide range of support from the college in terms of mental well-being and health, in terms of you each going to receive an academic personal tutor, which is one of the colleagues that work with us in the program, and you have monthly meetings with them. You can approach them anytime if there's any issues with your education, with the finance, etc. If people have disabilities of any sort, learning disabilities that affects their education, we have a disability center, counseling, and interfaith. So the support is here. And that's all I wanted to share with you in regard to some background to the program with Ash, and we're happy to take questions at the end. Thank you.
Thanks, Zara and Ash. Now over to Kishan and Antonia. Thank you.
Are the slides on? Can you see them?
Yeah.
Yeah, we can. All right. Hi, guys. My name is Kishan Sheth. So as Kate introduced me, I'm actually a dentist by background. Now, I had already gone into this program having done a master's degree. So I did a master's degree in implant dentistry. I'd probably done quite a few of these small courses with neurotoxin and filler. And I was actually, because of my previous experience of already having done an academically rigorous course, I was looking for the same elevation of my, not only clinical skills, but also academic skills in the area of facial aesthetics. So I currently practice between two clinics, one's at London Bridge and the other's at East Croydon. And I do a mixture of cosmetic restorative dentistry, implant dentistry, and now I'm starting to do more and more facial aesthetics. So that's a little bit about me. I'll now hand over to Antonia.
Thank you, Kishan. Just a moment to make this work. Okay. Hello from me too. My name is Antonia Fadil, and I am a full-time postgraduate student at the surgical pathway of the Aesthetics MS at UCL. I graduated with a degree in medicine in 2015 from Athens Medical School in Greece. And I am also a plastic surgery resident in Nicosia General Hospital in Cyprus. I am currently on my final year of training and preparing for the board specialty exam, which will take place next summer.
Okay, so this was a question that was on my mind before I actually embarked on this particular program. So what I think I'd say is what does definitely set this course apart is the established faculty. So three people in particular who've had a major role in my learning and development have been Ash Mosahebi, Dr. Tapan Patel, and Dr. Elias Tam. So Dr. Elias Tam is also my personal tutor. And what Dr. Zara says about the personal tutor checking in on a regular basis is absolutely fundamental, especially with a rigorous course of this nature. And, you know, we're all going into it as mature postgraduate students. So we've also got other social, personal responsibilities, as well as clinical responsibilities. And then this is sort of an added level of, not an added level of pressure, but a bit of a challenge. So the balance is very important. Having that sort of internationally renowned faculty to bounce ideas from, not only in the sessions, but also like the personal tutor outside, is something that has been very important to me. There is a mix of students in the learning cohort. So with my last master's degree, everyone was a dentist, whereas this one, I've actually found it quite stimulating, having a lot of medics around, having people who I wouldn't otherwise be learning alongside. And of course, the nature of the material is very different to what I've previously studied. The other thing is there's a practical driven element to the course. So there's a cadaver, there's a group of cadaver days. So it's not just kind of you're learning from the textbook, you're learning from the lectures, you're going away implementing things in practice. You are also actually embedding yourself in anatomy, which is a fundamental area of not only this, but also any kind of surgical speciality. So I think there's a number of things that do set this apart. And, you know, the faculty are very open-minded. So with my final year research project, for example, we're going to be looking into hyaluronic acid filler and injecting it into gums to regenerate areas of long lost gum tissue. So there was no one who naturally fitted into that sort of that position to mentor and supervise me. So Dr. Zara and Professor Mosahebi went out and they found Professor Kaveh Shakib. So he is actually an oral surgeon who's coming on board to supervise me with the project. So there is definitely, no matter what your aims and objectives are, and no matter what kind of topics you pick along the way to do the assignments or even the final year research project, there is a real emphasis on you getting the maximum out of this kind of learning environment. So I think you know that's all paid dividends for me on the course. And I'm sure it will do the same for you. I'll hand over to Antonio now.
Thank you, Kishan. Adding on what Kishan said, for me, this postgraduate program suits medical professionals very well since it's very flexible. The schedule is very flexible and allows students to continue working in their respective practices. For me, I have found it very helpful since I am also a resident doctor, a doctor in a training position at the hospital. Most of the lectures are online. A large number of them is pre-recorded and they can be viewed in one's own time, which suits, of course, overseas students. Also, one of its strongest points is the fact that it constitutes the only aesthetic surgery program at the master's level. And of course, one taught at the world top university by leading experts in the field. Therefore, the students get to access an exclusive network of well-known professionals. Additionally, there are opportunities to engage in research at rapidly evolving medical specialty and be part of the collective effort in scientifically evaluating aesthetic practice. I'm handing over to Kishan now to continue.
Okay, great. And alongside the aesthetics, I thought this might be an interesting exercise to kind of show you guys, not only, you know, neurotoxin, filler, all that stuff it plays the backbone on what this course is centered alongside. But on top of that, even the kind of stuff that you learn it is applicable in a range of disciplines. So, for example, a lot of my cosmetic dentistry, you're looking at, beautification. You're looking at trying to harmonize natural aesthetics, trying to regenerate not only teeth in some of these exercises, but also lost gum support, lost lip support, things like that. So you're starting to think a lot more holistically. And I've definitely seen synergies between what I'm learning on the course and what I'm able to implement into my day-to-day dentistry. So it's not just, aesthetics, you're only doing Botox, filler. Actually, the core fundamentals are applicable to a range of disciplines. And I thought it was quite interesting. There's quite a few people on here tonight who are dentists. But when you start looking at smile design and you actually take it from not only a dental perspective, but an aesthetic perspective as well, and start to understand the science behind cosmetics, I think that has played a massive role in elevating the standard of dentistry, but also how I apply aesthetics, not only to aesthetics, but also my day-to-day dentistry as well. And as I mentioned, my research project will be on using hyaluronic acid injectables in reconstructing lost interdental papilla. So that's what I'm currently plowing through at the moment, and that's the challenge. We've got a tight deadline ahead, but that's what I'm doing at the moment. So I'll now hand back to Antonia.
In my turn, I would like to expand more on what the surgical pathway of the aesthetics masters has offered me so far. As I said before, it has been a great opportunity to be part of a network of leading experts in aesthetic surgery. And as a training plastic surgeon, I have got a lot of refined knowledge on several different aesthetic applications, both minimally invasive and invasive, which is very important for a training doctor. This program gives us the chance to train and experiment and then implement the theoretic knowledge in a safe and controlled environment through scheduled cadaveric sessions where we are directly supervised by our professors. And this is very important in order to gain experience that will be used in one's own practice after the training is complete. Personally, I have found this an extraordinary experience, and I highly encourage people who practice in the field of cosmetic surgery to seriously contemplate this course. In my opinion, it is highly suitable for medical professionals who have some basic experience in aesthetic surgery, as this will help them refine their skills and form contacts within the aesthetics community. It's also a great opportunity, of course, to take part in aesthetics research. The project I have been working on is about the role of oral immunonutrition in aesthetic surgery under the supervision of Dr. Paul Harris. And I am also looking forward for the future that is ahead within my newfound family at UCL. Thank you very much.
Thank you so much, Kishan and Antonia. That was a really fascinating and insight into obviously two very different backgrounds. So that's really fascinating for you to be able to share that with us today. I'll hand over to Lauren now. Lauren, over to you.
Brilliant. Thanks so much, Kate. I'm just going to share my screen. Just bear with me one moment. Okay, just checking you can all see that.
Yep.
Okay, brilliant. So hi everyone, my name's Lauren, and as Kate said at the start, I'm an admissions officer in the Central Graduate Admissions team at UCL. So I'm just going to briefly talk to you about the entry requirements for both of the MS Aesthetics programs, and I'm also just going to talk you through some key aspects of our online application form and the application process. Okay, so first I'm going to talk about the academic entry requirements for both programs. So for the minimally invasive aesthetics route, we're looking for either a recognised medical degree or a dental degree, but you can also be accepted on the basis of having an advanced nurse practitioner qualification and registration with the NMC, or be a prescribing pharmacist registered with the GPHC. We'd also be looking for a minimum of 2 years training in your field, ideally with some elements of aesthetic practice. And then for the aesthetic surgery pathway, we would only be able to accept a recognised medical degree. And again, there's some required work experience, which is a minimum of 2 years training in head and neck surgery, maxillofacial surgery, or plastic surgery. And just a note, when we say recognised medical degree, you can check before you apply to see if your medical degree is recognised on a website called World Directory of Medical Schools, or WDOMS for short. Some other key points about the academic entry requirements that I just wanted to make. So whether or not your qualifications will meet the academic entry requirement can depend on the country in which you obtained them. So on both of the programme web pages on our graduate admissions prospectus, in the entry requirements section on both pages, you can select the country in which you obtained your degree from the drop-down section. It will give you a bit more information about what we would require from that country. But if you are at all unsure as to whether you're academically qualified for either of the programs, you're more than welcome to contact graduate admissions using our online contact form before you apply, if you're unsure at all. Another really important point just to mention is that meeting the academic entry requirement for the program doesn't necessarily guarantee you entry onto the program. As with all of our programs at UCL, applications are competitive, so we'll be looking just beyond the sort of what your academic qualifications are. And final point about the academic entry requirements is if you know that your qualifications don't meet the academic entry requirement, but you're still really keen to apply for the programme, we always advise that you just discuss this with the academic department before you apply. Also just wanted to touch on the English language requirements for the programme. So if you're not a national of a country that UK Visas and Immigration deems to be majority English speaking, you will need to provide evidence of English proficiency. So both of the aesthetics programmes on offer require the UCL standard level of English, and there's a few different ways that you can meet the English language requirement for the programme. So one way is through education. So to meet it using education, you would need a minimum of 12 months education leading to an awarded qualification that's been completed in a country that UCL deems to be majority English speaking, and you would need to have completed that qualification within 2 years before the start of the course. Similarly, if you have some work experience in a majority English speaking country, you'd need a minimum of 18 months of work experience that has been completed within 2 years before the start of the course. But one of the most common ways to meet the English language requirement, if you need to, is through a UCL accepted English language test. So we're able to accept tests taken on or after the 1st of September, 2 years before the start of the course. So if you're applying for September 2022 entry, we'd be able to take any tests taken on or after the 1st of September 2020. I would advise just checking our English language requirements page on the graduate admissions site of the UCL website, just for some further information on the tests that we do accept, as well as the scores that you'd need to meet that UCL standard level. Just a note, and I will touch on this in the next section about the online application form. If when you're making your application, you don't have evidence of your English proficiency, so for example, if you're not from a majority English speaking country and you know that you'll perhaps need to provide an English language test, that's fine for you to not have that at the point of making your application. But again, I will come back to that in just a moment. Okay, so I'm just going to talk through the key sections of the online application form. So at the moment, the application deadline for both programs is the 31st of March 2022, but I believe if there are places still available after this date, it might stay open for a little bit longer. Another key point just to note is that over this weekend until Monday morning, our online application system is actually undergoing some maintenance and won't be available. So if after this session you did decide to start an application, you won't be able to do that straight away until sort of midway through Monday morning UK time. Okay, so perhaps one of the most important sections of the online application form is the education section. So here we need to see evidence of all your qualifications from degree level upwards. So if you've got your undergraduate degree evidence, then please provide that. But also if you do have any other master's qualifications, anything, as I say, from undergraduate level upwards, we need to see evidence and information on that. So you'll have individual sections just to put what the qualification is, where you obtained it, and so on and so forth. And you'll also need to provide up to 3 documents for each qualification that you mentioned. So the 3 documents would be the native language version of your academic transcript, an English translation of your transcript, and your degree certificate. If you studied your degree in a country that is English speaking and you only have English versions of your documents, that's fine. You can upload a blank document to the native language section. The most important thing is that you do upload your academic transcript, and this is the sort of document that should be available directly from your university's central registry, and it should show all the modules you took during your degree and the grades that you've achieved. It's really important that you upload this before you submit, as it makes it a lot quicker when we come to begin assessing your application. And then, so as I was talking about earlier, there'll also be the English language section of the online application form. So like I said, if you're not a national of a UKVI, majority English speaking country, and you don't have details of an English test when you start your application, that's fine, because if you are successful in getting an offer to study at UCL, evidence can be provided later on, so that's fine. But if, however, you do have an English language test that meets that UCL standard level and was taken within 2 years before the start of the course, you can add in your English language test scores as well as uploading your test certificate. The other important section is the employment information section, which is of course particularly important for these programs given the work experience requirement. So you can provide details of your current and previous employment by putting it sort of section by section, but you can also choose to upload a separate CV if that's easier for you. There'll also be a section to add details of 2 referees. So for both programs, 2 references are required. We generally say that at least 1 reference needs to be academic, but if you've been out of education for 4 or more years, it's fine for both references to be from employers or professional references. We do strongly advise that you list professional work email addresses for your referees. And in terms of how the referencing system works, what will happen when you submit your application is your referees will be sent a reference request email from UCL, and there'll be a link in that email that's valid for 30 days that they can use to submit the reference for you. But it's really important that you make sure that your referees do submit references for you. That is the applicant's responsibility. So once you submit your application, you'll be able to log into your applicant portal and see the status of your references, so you can see if they've submitted. And if it's been a little while and you can see that they haven't submitted, then it's always best to get in touch with your referee to make sure they do that. And the deadline for receiving references is 10 working days after the programme application deadline. And then the personal statement section. So we often get quite a lot of questions from prospective applicants about how they should structure their personal statement and what they should include. So I'll just briefly touch on some of the key points there. So on the online application form, there is a 3,000 character text box, or you can upload your personal statement as a separate document, but we say that should be no longer than 2 pages. So generally speaking, it needs to show why you want to study that subject at graduate level, but also specifically the MS Aesthetics program that you're applying for, and why UCL specifically. So this is where you can really show that you've done your research on the programs, on the department at UCL, and that will be something that can really make your personal statement stand out. And we also want to know how your academic and your professional background meet the demands of the program, as well as your career aspirations and what you aim to do after studying the MS Aesthetics program. And finally, when you come to submit your application, you will be required to pay an application fee. So for each of these programs, it's £90 and you pay per application that you make. You can pay this on submission of the application form. So when you press submit, it will take you straight to the application fee payment page. If you don't, you will be emailed with a payment link that you can use to pay later on. But please bear in mind that we won't receive your application until the application fee has been paid. So just to give a few very brief points about what happens after you submit your application, just a key point before I do go on to that actually is that it's really, really important to thoroughly check through your application before you submit to make sure that all the information you've put on there is correct and all the documents you've uploaded are the most up-to-date versions of they're the most up-to-date versions of the documents. This is because no changes can be made once you've submitted, so we're unable to accept sort of amended personal statements, updated transcripts, things like that after you've submitted. So once you've submitted and paid, I did mention this earlier, you'll get access to your applicant portal where you can view the status of your application, the status of your referees, and you can also, if we request it from you, upload additional documents that we might need. And the final and important point is that we don't begin assessing your application until it's what we call complete. So this means we can't start assessing until you've paid the application fee, we've received both of your references, and we've also seen your academic transcript has been uploaded to your record. So that's a brief overview of the entry requirements for both programs and also the online application process. If you do have any admissions related queries, of course, please feel free to pop those in the Q&A or ask in the Q&A session now. So I will just stop sharing my screen and hand back over to Kate.
Thank you so much, Lauren. That was really, really useful actually for us to all take away. So yeah, we can move on to the Q&A part of the event now. So I can see that we have a few questions already in the Q&A box. So that's fantastic. Thank you so much for submitting those. Please do feel free to just keep submitting questions. We've got another 15 minutes, so we can use that time to go through as many questions as possible. So to go to the questions now, so we have a question: how is the program different from level 7 aesthetic course? So I think maybe that's in relation to the program as a whole. I don't know, Zara, would that be something you could
So I'm not
answer?
very clear what the question is asking. Level 7 is a master's program and this is a level 7 program. So I'm not sure what Amina means by level 7 aesthetic course. Is that a specific aesthetic course you're referring to elsewhere? But as a postgraduate program, our program is level 7.
Okay. Amina, if you want to step in and elaborate, please do feel free to. And I know there's another couple of questions actually in the Q&A about the syllabus layout. So I don't know, again, Zara, do we have?
Yeah. So
Yeah.
the syllabus layout, as in you mean the detail of all the various lectures, their topic titles, etc. And normally we don't share those things at this stage because what we taught this year might slightly differ for next year, as in we've already contacted some of, we always want to progress and evolve. So we are kind of mixing some of our modules. The same content will be taught, but in a slightly different way. I'll see if I can share that with you, but I don't want to give you the wrong impression. I assume you want the exact details of the titles of the topics that we teach, perhaps? I mean, it's a very comprehensive list, so.
Fantastic, thank you. So we have another question as well. So this question is, can I practice aesthetic medicine and surgery after this course? And can I independently inject after this course?
I'll pass that over to Ash.
Yes, thanks, Kate. So, I mean, I want to compare the course with doing a medical degree or a dental degree. At the end of this, you're not going to be a expert in giving treatment or medications. What it will give you is a very good background and knowledge to be able to do this. So I think this goes together with doing further practice and further experience to get this right. As far as being able to practice medicine or dentistry, that is something you need to do with both GMC registration and GDC registration.
Fantastic, thanks so much, Ash. And we have lots of questions that have just come in, so that's fantastic. So I'll just go down in the running order in terms of, so the next question is, how many face-to-face teaching sessions per term are there? So again, perhaps Zara.
Yeah, that's for me. So face-to-face for this year in term 1, which was from October till December, the Christmas time, we had 2 full days of face-to-face, which were after each other. It was actually a Friday and a Saturday. For next year, it might not be a Friday and a Saturday. It's more likely will be a Thursday and a Friday or a Wednesday. Just don't want to include weekend because colleagues who have families, it's hard for them to come to the college for that reason. So as I said, we're evolving as we go along, but it was literally 2 full days and they were after each other to appreciate the students who are coming from abroad and they're booking a ticket. They can just come for the 2 days and then they can go back to their home country. So not 2 separate days. In term 2, which is now we are at the moment, there is not really, hasn't been any face-to-face. The only other face-to-face that's left is more or less towards the end of this term, beginning of term 3, which would be our cadaver lab-based sessions. And for that, for this year, is 2.5 days per module. So if you're doing minimally invasive, the students who like Kishan is doing minimally invasive, is going to come 2.5 days in May, 2.5 days in June, and those days are after each other again. So say Wednesday, Thursday, and a Friday in May, and the students know about those dates. And then Antonia is from the surgical pathway. She's also coming on the same days, but she will have her own training separate from the minimally invasive. I was just looking at Amina. I think she said she just wanted to have vaguely some rough ideas. So Amina, I don't know which one of the pathways you're interested in, because in the interest of time, maybe we'll answer other people's questions. And if there is time at the end, I can just read out some of the titles of what we teach to answer Amina's question about the topics.
Okay, fantastic. Thanks, Sarah. So the next question we have is about what is the competition ratio? So how many applicants and how many places do you have available?
So that's a tricky question. And it depends, you know, if we get a long list of applicants, obviously we're going to be more picky and looking to see if the ones that suit us best and suit the program, they have enough experience, they've got previous qualifications, otherwise they'll struggle. There isn't, it depends. I think we can take easily up to 20, 25 students, but more than that, we won't have the capacity because we're very specialized, and the cadaver lab sessions and the skills we teach, we want to sort of provide enough face-to-face and one-to-one support for the students that more than that is going to, at the moment, is going to be difficult, especially we're in the first few years. Once the program is evolved and we've, you know, learned a few tricks, then we can expand. But for next year, potentially, I'd say 20 to 25. Ash, I don't know if you have anything to add to that, but I'll probably stick with that number.
No, I agree with you, Zara. It just depends on the year, on who's been applying. As long as you meet the basic requirements that Laura went through, your application form was definitely be looked at and evaluated and considered. So it just depends how popular it is for that year and what the competition is. But yeah, we do have a limit of around 20 or so students.
Fantastic. And we have another question that is related to someone who's submitted an application. So when do you start giving out offers? And if potentially they don't get in this year, will they stand a better chance in reapplying next year?
Yes, so we're waiting for the deadline of end of March to come, so we have a better idea. So just after the end of March, we'll start giving offers so that we've looked at all the application forms we've received. If people don't get in this year, then you need to look and see what areas you need to improve potentially and then come back again. Yeah, there's no, you can apply multiple times. There is no such rules that because you applied this year and you didn't get in, you can't apply next year. But I'd say the question is why you did not get in and what are you going to do about it in a year time? Can you achieve those criteria to be able to qualify to apply? So yes, you can apply again.
Thanks so much, Zara. We have another question, which is from a attendee. So they're saying, I have my IELTS exam scheduled on 23rd of April, but the application deadline is the 31st of March. So will that affect their application since they cannot provide their English requirements at the moment?
I'm happy to take that one as it's an admissions
Thanks,
one. So that's absolutely fine. I would just advise that you apply as soon as possible. It doesn't matter that you don't have your IELTS scores yet. So what would happen is if you're successful in getting an offer to study on the programme, we can just include that as a condition of your offer and you can provide that later on. So that's fine. And we always say to our applicants, it doesn't affect how your application is assessed as to whether you've got your English language test scores on there or not. So that's totally fine.
Thanks so much, Lauren. And we have another question. So do we have the opportunity to practice minimally invasive techniques on model patients to build a portfolio? So again, Zara. Probably.
Yeah, I'll attempt that, and Ash can join if there is anything to add. But as far as I'm aware, with the NHS, which is the National Health System in the UK, it's very difficult to get people in without the GMC number, with all the sort of patient confidentialities and all the rest of it. So we cannot really take students, especially that most of them are coming from international places. What we teach is something that will fit all the students. So we cannot separate the students and give one priorities over the others. Since we cannot take international students or those who don't have GMC numbers, etc., into the NHS with patients, then we don't provide. So we only teach the stuff that we can give to everybody. But we have cadavers. So we have cadavers which are, similar simulations. These simulation systems are there. Ash, I don't know if you want to add anything to this.
No, Zara, exactly as you mentioned, because some of us cannot practice in UK, we've decided that we will not have a hands-on training to disadvantage some of the students compared to others. But you can closely collaborate with your personal tutors, which quite often are very experienced and they can help you along as well.
Fantastic. Thank you, Ash. Thank you, Zara. So we have a few more questions. Another one is, when and how are interviews conducted, and when would we expect to receive an offer if you're successful?
So you'll be very lucky to hear there's no interviews. It's not medical, it's not MBBS. MBBS would have an interview. However, having said that, if we look at an application form and there are areas that are not clear to us, we want some sort of clarification from the student, or we would like to have a chat with them, we'll either email you or ask you to join us for a 10-minute chat, but it's not an official interview, just so that we want to make sure that we are fair and we're clear on what you've submitted online. So if there's an area of concern or area that needs clarification, we will contact you. We won't just assume on what you have uploaded, but obviously make sure you read all the instructions about what to upload, and what Lauren said, that's very important to make our life easier. But if we see a student potentially has the potential to join us, and we're not so sure about aspects of your qualification or any other things in your document that you've uploaded, we will contact you. But otherwise, there is no official interviews.
Fantastic, thanks, Zara. And we have another question. So basically, I think this is possibly to do with the entry requirements. So just saying, I've done my BDS and have done aesthetics course and implantology courses as well, with an experience of 2.5 years, including my internship, but I don't have a master's degree. So will that affect my application as in eligibility? So potentially Lauren, I don't know.
Yeah, so I think if the fact that you don't have a master's degree, I don't know if Zara is able to offer any input on this as to how that affects how you're considered, but that's not required for this course, so that's fine. If you've got a BDS, it depends which route you're applying for. I was just going to say, if you're applying for the minimally invasive aesthetics route, then a BDS is fine. If you're just applying for the aesthetic surgery route, we'd be looking for the MBBS, so just an undergraduate medical degree. But if you're applying for the minimally invasive aesthetics route, then that should be fine if you've got the BDS and the work experience. Zara, I don't know if you had anything to add on that.
Yeah, no, I think you answered this very well, Lauren. Thank you. So yes, if you don't have to have a master's degree to apply for this. I mean, I know Kishan had a master's degree and this is his second one because maybe he's very motivated or he has his own reasons, but you know, that's not a requirement, exactly as Lauren said. You don't need to have that. And just as she mentioned as well, since you don't have surgical background, you won't be able to apply for the surgical pathway, but you could apply for the minimally invasive. Hope that answers the question.
Fantastic. And we have another question that's just come in, which is about, will the MS aesthetic surgery also cover the minimal aesthetic surgery study? I'm not sure if maybe Mohammed wants to elaborate on that one.
MS aesthetic, let me just see the question again.
So it's MS aesthetic surgery will also cover the minimal aesthetic surgery study.
So MS aesthetic, the minimally, oh, sorry, Ash, did you want to go?
No, I was just going to say that we do have a common module which covers the fundamentals of aesthetics. So that's common in both minimally invasive and surgical routes, but then they separate into their own entities. So yes, if you really want to do more minimally invasive, even if you're a surgeon, or surgical background, you're better off applying for the minimally invasive one.
The number of cadaver lessons and the intensity is just not possible to give surgeons in the second term or wherever we put it in the timetable, those detailed minimally invasive. But as Ash mentioned, the common core modules you'll all cover, principles, fundamentals. But when you go into your specific pathway, then yes, and like Ash said, if some of you are surgeons and you really want minimally invasive, then apply for that. You qualify for that anyway. It's the other way around that doesn't work. So if somebody is not a surgeon and they want to apply for the surgical pathway, then they're going to struggle, and we don't recommend that. I'm just looking at the questions. So Amna is said specifically she wanted to know more about the minimally invasive. So things that I'm just looking at the timetable in front of me on my screen, things like superficial fillers, laser safety, patient factors that affect the outcome when it comes to fillers, neurotoxins. We have a large series of sections on neurotoxins with Dr. Sophie Samizadeh, and she's brilliant in that field, and she runs webinars as well with the students in both minimally invasive and then in the advanced one. She continues her lectures and they're pre-recorded, but then she runs a webinar. I attended one of them the other day. Chemical peeling, skincare, treatment planning. We do a couple of quizzes as well on complications with patients. Some of the colleagues, Professor Goodman and I think Dr. Isolda, they presented various case studies from their field of expertise, dermatology, and the students were answering. It was like a quiz, very interesting. They were discussing various aspects. And so these are, in a nutshell, some of the stuff we teach in minimally invasive. I hope that answers your question. Just to be fair, that I'm also covering the surgical pathway, because I know some of you mentioned in the questionnaire that you're with surgical background. So we have the head and neck and the breast and torso. Maybe just read very, very briefly some of the stuff in their timetable of teaching, which is Antonia's timetable. So last 1 second, my page is loading on the screen. We have things around, so the breast and torso is divided into obviously the breast and body, and the breast and then body and torso. They have various things around. Just 1 second, I think. Let me just bring the right page. Okay, so breast and torso, there we go. So the breast and torso module is very well sort of a huge number of colleagues are working on that with their own specific expertise. So things like fat grafting, breast asymmetry, massive weight loss discussions, breast implant choices, augmentation. So things around that, really interesting videos, and also things around gynecology sections, you know, vulvovaginal rejuvenation, then thigh lifts, liposuction, and things like that. That's for the breast and torso. And, you know, don't take these as well word by word, because things might slightly change for next year, but it will be around the same topics. And then for the head and neck, they kind of look at, is Mr. Rana Dasgupta is the module lead, who is very well known in the field of head and neck surgery. And he teaches with his team of colleagues various things about, so they teach the anatomy first of the different sections of the face, and then the facelift technique, the mid facelift, pinoplasty, eyelid anatomy, rhinoplasty, primary and secondary, and so on. So that's in a nutshell a brief summary of what we teach.
Thanks so much, Zara. Well, I think we've actually gone over time slightly, so apologies in advance if we weren't able to get to your questions, but please do feel free to contact us following today's event. I know that Zara will be, and Ash are very happy for you to contact them if you have any specific questions about the programs. But equally, we really hope that today's session has given you an insight into and hopefully answered your questions to the best of our ability. And just want to say thank you so much, Ash and Zara. Thank you so much, Antonia and Kishan and Lauren, for your presentations. They were fantastic, and we really hope that you have some good takeaways from this event. So thank you so much, everyone. We do have a short survey at the end of the event, so if you can just give us a bit of feedback about how you found today's event, that would be really beneficial. And good luck with the applications, and we hope to see you at UCL. Take care, everyone.
Thank you. Okay, thanks everyone for joining.
Yeah, thank you. Bye.
Bye. See you.
Thank you.
Bye.